Judson Hill, thanks for making time.
Yes, sir. Thanks for having me.
Well, we had you on, I want to say it was late March, early April. I think the legislature had passed some amendments or updates to the cannabis program in Georgia. It was awaiting the governor's signature. Those things happened. The governor did sign it, went into effect. You're going to correct me if I'm wrong. July 1st. We had something about it in our newsletter. What do I have wrong and right so far?
All of that is correct.
Good. It's like I pay attention.
Yeah.
And so it's been in effect. What is today? Tuesday, July 14th. How's it been going for 2 weeks?
Amazing. The patients obviously have been waiting for this. Over time, we expect to see more patients in the program. But in the 2 weeks alone, it's just people that had never showed up before, even that had a card or that maybe came once to check it out, are now, lined up around the store. July 1st, we had, an hour line before we even opened. Our best sales day by 5 to 10x.
Wow.
This month, we've already had our best sales month by the 10th of the month. So clearly people are showing up, and again, there will be more patients over time, but I think it was really just the pent up demand of people looking for the flower and vape products that the new law offered.
That's what I want to get to, because it wasn't just more indications to add to the list in Georgia where you can get medical cannabis, but there were actually new form factors which weren't available before. Refresh us, because it is a big deal.
Yeah, so the changes, were very significant across the board, but I'd say really twofold. At the highest level, we're the 41st state now with a medical cannabis program. So before this law went into effect, we were still a low-THC oil program, which was why there was so much pent-up demand. The new products were flower and vape. All of those products are meant to be vaporized, so the flower is sold non-combustible to be vaped. Then we have all-in-one vapes. We have your standard vape cart. Clearly, that's what most people buy in the dispensary. And from a medical point of view, they have the quickest efficacy, because that goes to the second part, which was before the law change, you were required to basically be on your deathbed. So it was not just cancer was a condition, but it had to be severe end stage. So we removed most of those qualifiers, which didn't necessarily add a condition, but it just opened up how soon you could get it.
Interesting.
Rather than have something to kind of pacify your last few days, it was now like, let's, have doctors give this to folks as soon as possible and try and treat their condition.
And when last we spoke, it really is now normalizing or more normalizing the medical cannabis program in Georgia to align with other medical cannabis programs, or more align with it. And you predicted what the result would be, which is an hour-long line before you opened up, many more patients into the program. And in some respects, I guess, normalization of a program that was just waiting for it. I guess the operational question is, like, how did you ramp up for that? Knowing it was happening, because we talked to you for months, but it is difficult to go from a trickle of people to an onslaught and be able to open your doors and get them the products they want and need. Talk a little bit about that operational challenge and sort of how you overcame that or prepared for it.
Yeah, well, on the good news, the input ingredient for all of our products all along was flour. Right. So we had that ready to go. We've obviously been producing oil that was put into the other products, so we had the oil ready to go. So that was a good step of, we have our base ingredients, and then really the law passed in April, the governor signed it in May, and it went into effect in July. So we really had 90 days to sprint to put together, packaging up eights, vape carts, what have you. But our corporate team is based out of Connecticut. We operate in Connecticut and Massachusetts as well. So I'd say it was really kudos to them. Where clearly we created these products before we were able to roll out the same SKUs of what was allowed. And then our retail team just was really trained up, and we started hiring, because on top of it, we opened a fourth store the week before July 1st. And medical cannabis was rescheduled to Schedule 3 all during that time. So it was quite a whirlwind, but all positive for us over the last couple of months here.
Yeah. And what's the response been from those people in line and getting either their card for the first time or getting products that they want for the first time? Like, is it, I can't believe this day actually came? Is it thank you so much for being able to open your doors and welcome us? Or is it all of those things all wrapped up in a few weeks?
Yeah, I mean, it was really cool. I guess I was the person out giving water to folks in line because it was 100 degrees. It was like a Curb Your Enthusiasm episode, but you're
not allowed to hand out water.
Yeah, well, here you are. But yeah, they're like, who are you? We don't usually see you at the store. I'm like, I'm just the guy that hands out the water. But no, I mean, they were clearly very thankful. And I mean, I think most people, myself included as a native Georgian, like couldn't believe it that you're legally able to, sell these products people have waited so long for. So definitely thankful, excited, no complaints with waiting in line. And I mean, our team really did a good job of, now it's 14 days into the month and the onslaught of just demand hasn't really slowed down much. I mean, every day has been better than any day we ever had before July 1st in the past 2 weeks. So, yeah, I think people have been patient and happy to have the products, and our team has really done a good job of keeping moving.
And not to point out the obvious, the sky has not fallen in Georgia. Is that right? Is that correct?
Well, as someone that grew up here, and I know you went to college here, cannabis existed before July 1st. So no, I don't think the sky has fallen. And I think if anything, it just obviously drives people to the regulated channel. Cause again, I don't think all these people never had these products before July 1st. Clearly they were getting them elsewhere, and now they're going through a safe regulated channel, which is what we want to see.
Yeah. And we're seeing movement. I'll call them southern states. I mean, people can debate whether Virginia is a southern state, but I'll call it a southern state for the purpose of this conversation. We've seen movement in Virginia. We've obviously seen movement in Georgia. Like it's slow going in the South for sure. But do you think how the next few months go will have resonance not just beyond Georgia, but like in other neighboring states too, that you can do this, you can do it safely, and maybe importantly that there really is demand for it, and the sky doesn't fall, sort of all of it. Are neighboring states watching what happens in Georgia and saying, we may need to do this, and we can do this, and we can follow Georgia's model, and we can call Judson whenever we need for advice?
I would hope so. I mean, I'm biased, but I think Georgia, Atlanta is really the capital of the Southeast. And I mean, part of me moving back here from California 2 years ago was simply the Southeast was the last region on the map that needed help, and that was where I was from. So I think it's really like the bright spot, or a bright spot of the industry going forward, because clearly some of the more mature markets have their challenges as things get saturated and what have you, and we will have those one day. But right now we're just at the starting point. So like Alabama has a program. It's been slow moving like Georgia. I assume it will be, a similar story, but I think get up to where Georgia is. I know Kentucky has rolled their program out pretty quickly. South Carolina, North Carolina, and Tennessee have nothing, but I think with hemp and what happens or doesn't happen with November, I guess those are big hemp markets. So clearly they will need a place to send people. And I know there's a lot of talk in the legislature there about rolling out medical programs in those 3 states. So, yeah,
it is interesting to watch. And certainly you've put some good time in over the past 2 years in Georgia, and now seeing it come to fruition. Give a little sense of what you might see next, right? You said you've had to bang up 2 weeks for sure, but it is also the dead of summer. It is super hot, universities and colleges are out of session for now. Like, do you how do you even plan for growth with huge question marks out there? Just do your best to deal with the influx, or are there plans in place to say, you know what, we think after Labor Day, when people come back to school, there may be this new influx, how do you plan for those big unknowns? Like any market where that opens up, it can be a challenging sort of scale up.
Yeah. Well, I mean, the Department of Health in Georgia gives us weekly updates of the patient base. So it went up 1,300 people from July 1st to the 7th. Normally we don't see 1,000 maybe in a full month. And again, that's kind of all just word of mouth because we're not allowed to market by law. There's been a lot of media coverage, I would say, but yeah, one would anticipate that ramping up. And I mean, I think we could easily have 60, 70,000 patients in the program by the end of the year. Because I mean, I don't think there's less sick people in Georgia historically,
No.
but our patient base was about 0.02% of the population, where most medical have 2%. So yeah, I guess we're kind of just using other states. I'd say like Florida has a very similar program and kind of how it started there 6 or 7 years ago with when flower was added. So yeah, looking at some of the analogous states, looking at the data, and just prepared to. We want to be the go-to for flower and vape because also what's interesting is we can wholesale in Georgia, unlike Florida.
Right.
So yeah, we can provide to the other licensees as well.
And how many other licensees are like? What does the footprint look like of? Well, Fine Fettle for sure. You talked about your fourth store, but what do the others look like? Like how many dispensaries are there? How many other players are there? And do you expect more as this thing rolls out?
Well, there's only 6 licensees in the state. We're all vertically integrated. I'd say there's been 3 of us primarily over the last 2 to 3 years that have really been operational, with Trulieve clearly being a large player in Florida, and in Georgia, I think they're the only ones we could each have 7 stores open currently. So the store count, I think I've told you before, but increases as the patient base does, which is unique to Georgia versus Florida per se. So it kind of keeps us all on par. Trulieve has 7 stores. Botanical Sciences is another local Georgia operator. I think they have 5. Fine Fettle, we have 4. So, but that's 16 right there. And then I think the other 3, only 2 of them are opened up recently, and they each have a store apiece. So whatever, puts us at under 20 dispensaries for the state. So I think the exciting thing also is like Georgia's a huge state. There's 11 million people, and people need better access than 20 stores to go to. Right.
So there's room for growth both in patient count, but also serving those patients.
Yeah, and I mean, it kind of goes hand in hand where every 10,000 patients, we each get a new dispensing license. So like we just opened a store in the Evans, Augusta area. Like I mentioned a couple of weeks ago, we're opening a store in Macon in the fall. We'll be opening another location in Q1. So yeah, I think by this time next year, there should be at least 30 to 40 dispensaries. So double what there is now.
Yeah. Well, and commensurate with that, the number of patients being served, that's an interesting model to say every 10,000 patients, everybody gets a new license. That is both, this is the word you use, like if your car sort of like a governor on it, like there's a governor on how many stores you can open based on patient counts. But also on the other side, you can't really, it's very challenging, I would imagine, to get, for you, from Fine Fettle's perspective, to get more people in, right? Because that's sort of out of your hands. Like, is there a way to like,
well, I mean, we partner with a lot of local doctors, and I guess to all the changes, like, I mean, both with the change in Georgia and then obviously the rescheduling, hopefully remove some of the red tape and just hesitancy, because clearly we want more doctors to be comfortable with this program. So therefore they recommend this to more of their patients. And even things like removing the severe and end stage qualifier. A lot of doctors just said like, that isn't even a medical term, like severe cancer. So I'm just going to default to not doing it because I don't want to risk my license by giving out a card when I don't even know what technically qualifies. Right. So I think a lot of those changes and kind of our partnerships with the physicians should help accelerate it. And then clearly, again, like the word of mouth, and telemedicine is an option in Georgia. So you can get a card via telemed. And then also, I think the interesting thing we haven't really talked about is Georgia's the only state that allows for private pharmacies to sell the medical cannabis as well. So,
really?
Yes.
But only private ones, not
yes,
like
no Walgreens or CVS.
Oh, really? Interesting.
There's like a lot of local, mom and pop pharmacies still in Georgia, and it was originally written into the law, I don't even know, maybe close to 10 years ago. And it was funny because my dad was in the legislature at the time and I was still living in California. And I was like, what are you guys thinking? DEA oversees pharmacies, like no one does that. And two or 3 years ago, when the first 2 operators in Georgia opened, they tried it, and the DEA basically came down with a heavy letter of,
don't do that.
Yeah, exactly. So anyways, it kind of went away. And then in the past month or two, with the rescheduling and with the new products, and just kind of, these are small businesses that need a new revenue stream, and they're like, there's all these new products coming, there's new demand. It's rescheduled to Schedule 3 like other drugs we sell. So this pharmacy thing has started to pop up again, and some pharmacies are dispensing medical cannabis, which is
as someone who's able to wholesale, that sounds like a good plan.
Yeah, it's just that, I guess, like all things in cannabis, like, does that really last or exist,
right,
or how long until that one goes away?
Right. It's so interesting. I hadn't heard that. And I live in Canada. We have a medical cannabis for a long time, and it was never like that. Although someone did set up a facility, like a dispensing pharmacy, a dispensary, if you will. But you went in to see a doctor, you got your authorization, and the only way to do it was to sort of mail it to you. So they like mailed it across the counter, like it was sort of makeshift. But they had a doctor on site or a medical professional on site that was authorized, and then you went to the next room to actually receive it. Like there was a workaround, but it did not last, right? It wasn't a super viable option. But this one is interesting. It'll be interesting to sort of track that and see that as things go, and then also see if other states sort of take that as a model.
Yeah, I mean, I guess logically it makes sense that they already are in the communities. People go there to get their medicine. It's a great way to provide more coverage. But I'm just never sure how these little workarounds
how long
they go or last. So we've really been focused on, driving folks and product to our current dispensaries.
Sure.
But it is something worth noting in the Georgia market that's pretty unique.
That is more than pretty unique. That is unique. That's one of one, as far as I can tell.
I'm pretty sure we're the only one.
Yes, it's unbelievable. Well, Judson, I appreciate the time as always to give us an update of what's happening in Georgia. Good luck, because it sounds like the influx is going to continue, and you will all be busy. Kudos to you for serving water in line, because it is hot as heck down there. But good luck over the coming months, weeks for sure, and months overall, because things are likely to grow. And we'll check in with you maybe post summer to see how things transpired during the summer.
Yes, sir. And
great.
Hopefully we'll have you down here soon. Let me know when you're in Atlanta.
I will. I try not to go when it's midsummer for obvious reasons, because it's way too hot here, and I shouldn't say that. I'm actually going to Florida next week, so it's like out of the frying pan into the fire or something, I guess is my summer plan. But I appreciate the time and look forward to connecting.
Yes, sir. Thank you for having me.
You got it. Thanks, Judson.
Bye.